Well, I'm here today with Bruce Broussard, the President and CEO of Humana. Thanks for joining us.
I'm glad to be here.
So here we are, we're 2 weeks roughly into the launch of the exchanges. What are you seeing?
You know, we're seeing first, backing up, that the exchanges probably are a good thing. It's expanding coverage for people, and we think that in the long run will be the right thing to do. In the short run, it's got some bumps, and I think the industry and the government expected that. But we are focused on fixing those bumps and to work with the government to make it both a good experience and at the same thing relative to driving down healthcare costs and improving the quality.
As you know, there's been a real dispersion among your peer group of large insurers as to whether to participate in the exchanges. So there was a nice note that Justin Lake of JP Morgan did where he found that Aetna has 55%, is covering 55% of the uninsured market in the exchanges, and you're next up at 39%, and then there's United all the way at the other end at basically zero. Talk to us about what your thinking is strategically as to why to be involved in the exchanges and to what degree.
Well, we think long-term exchanges are going to be a good thing strategically. We see that consumerism in healthcare is growing, and we think that this is a great way to facilitate that. So we look at this opportunity working with the government and being able to participate in that. And so we chose 14 states, and the 14 states we chose is markets that we're already in, and being able to leverage what our network and our experiences there, and being able to cover more members in our existing markets.
So that was the key driver, that you already had the networks in place, and so going into those markets was really pretty straightforward in terms of negotiating with the hospitals and the doctors.
Yeah, as you well know, to be able to bring an affordable product out, you need to have a strong network, and that's really where we started from.
Have you found that there's a different climate in different states about how to encourage more carriers to participate? We're seeing, as Shubham Singhal of McKinsey showed earlier today at the conference, there's a wide variation in the number of plans and number of insurers that are participating in different states.
Yeah. I think it has to do a lot with the state, and not only the state and the governmental side, but I think it also just the healthcare delivery system. I think a great example is us being in Mississippi. We're one of 2 carriers, and actually one of only 1 carrier in a lot of the counties because of the remoteness, because of the health of Mississippi, and so a lot of carriers just stayed out of it. We chose to go in it because we felt that it was the right thing to do, and at the same time we felt that we could help people through our experience through our Medicare Advantage program.
The argument you hear for the other side, which is the wait and see argument, is, as Shubham talked about at the panel, we just don't know what the risk pool in these states is going to look like. Are the healthy going to sign up, or is it just going to be sick people and poor people? How did you think about that problem? Why not just wait and see how things evolve?
And that's a very fair strategy, and you know we had thought about that strategy, but as we looked at it, it was a great way for us to learn and also be supported by the government through their 3 R's, which allows some support in being able to price and as you talked about, adverse selection.
Explain what the 3 R's are for people who aren't familiar
well,
with that
it's
concept.
around risk management, it's around risk corridors, it's around reinsurance, and it's around risk adjustment. And those 3's are trying to stimulate carriers like Humana to come into marketplaces and not take undue risk. And it's sort of trying to equalize in the earlier years around that adverse selection.
So you don't have to worry about sicker people signing up for your plan and healthier people signing up for one of your competitors, and them being able to have lower premiums as a result.
Right. And what happens is at the end of the year, or it'll be a fairly complicated process, it gets redistributed through the industry as you start to see your risk selection.
One of the other big areas of competition among the plans on the exchanges appears to be the networks. So which hospitals, which doctors will be served. What are you seeing there in terms of reimbursement rates? Earlier in the year, we'd seen somewhere between Medicare and commercial is where the reimbursement rates for hospitals and doctors were coming. Is that continuing to be true? Do you think that will decline over time as consumers gravitate towards cheaper products or less expensive products?
I do think it is a price-sensitive market, and I do think that will put rates in the marketplace. I couldn't tell you if it's Medicare or Medicaid and where it will end up, but I do think that constant consumer choice is going to push pricing in the marketplace as a whole.
Do you worry that only sicker and poorer people will sign up? How confident are you that the young and healthy will enroll in the exchanges?
I think that the verdict's out on that. to be honest with you. I think the verdict's out, and we look at the 3 R's as helping protect us in that, but I think the verdict is out in that. I think that federal government is, and the states are trying to stimulate more and more people to sign up. I think as the penalty increases for not having insurance, probably you will see more people sign up, but in the short run it could be people that just need coverage.
Are you concerned at all that the 3 R's actually incentivize plans to enroll sicker patients because of the way the risk adjustment is structured?
Both within individual and I think also within Medicare Advantage, it's almost like an anti-insurance, is where it's upside down, that taking care of sick people is encouraged in that area, and I think you see that in the Medicare Advantage side, and you also see that in the exchange side. That's not a bad thing, because people that are needing care are now being taken care of. And as we say internally, it's not just about the sick care, it's about how do you keep people healthy. And this particular, both in exchanges and Medicare Advantage programs, incentivize that.
Do you see yourself, if the 14 states go well, expanding into the other 36, or are you going to stay where you have your networks established?
I think it all depends on how successful we are, and also how we can create further relationships with providers, because that is a key part of this. And we have a very strong history of partnering with providers as we came from the provider-centric aspect. And I think as we expand, we have to expand with very good partners on the provider side.
Let's talk about Medicare Advantage. Humana is one of the big players in offering Medicare Advantage plans to seniors, and I think it's now up to 30% or something like that, the percentage of seniors who enrolled in Medicare Advantage, and it keeps going up. And this is interesting because CMS, the Centers for Medicare and Medicaid Services, they say that the cuts to Medicare Advantage in the Affordable Care Act will drive seniors out of that system, that 50% by 2017, I think is the number, will move back to traditional Medicare from the market-oriented Medicare Advantage program. Why do you think that's not happening, at least not yet?
You know, since 2010 there has been significant cuts in the Medicare Advantage program. What that has done is it's stimulated innovation, and that innovation has allowed to increase the quality of care. As you can see from the STARS, which is a measurement of our quality, it's actually gone up every year. And then secondarily, it's lowered the cost. And that's really, I think, the neat thing about turning it over to the consumer and having companies compete for people's business, is that innovation is created. And as I see in the future, I think we'll just get better and better in being able to offer a higher quality product at a much more reasonable price.
One thing we talked about on the panel this morning was this move for large employers to shift to private exchanges like Walgreens. There was a big story in the Journal. What are you seeing on that front?
I think in the short run it'll probably be slower than it won't be the majority. But I do think long term the United States is going to see a continued movement, as we did see in the retirement a number of years ago, where it went from a defined plan kind of retirement to now a 401k kind of environment. I see that happening where you can offer broader choice. It can be more customized to the individual as opposed to just an employer group or a specific class of employees. So I think it's a good thing. I just think it'll take time for both the employee to feel comfortable and the employer, but I do believe over time you're going to see more and more companies do that.
Is that a more attractive business for you than the ASO type business, where you're just administering the plan for self-insured large employers?
I think we can add more value. I think in the plan that's just directly to the employer, it becomes much more around price, and price isn't everything. I think you can offer so much more in healthcare, and especially as you move into health as opposed to sick care. And I think we can be much more valued partner in that particular model, and I think we can expand our business as a result of that.
Final question for you. So what do you think about the evolution of HSAs and high deductibles? Another thing we talked about today, there's been huge growth in account-based health plans, but the ACA obviously changes some of the regulations around how those plans can be treated. So how do you see that evolving in the future?
I think it's a good plan overall. I think regulation might impact the growth of that, but I do think you cannot have a high deductible plan without having a very good prevention and primary care underlying that. Because when you have a high deductible plan without that particular base, then people ignore the prevention side, which then sort of kicks the can down the street and becomes bigger and bigger the problem. So I think having that, but you have to have a solid primary care component to fulfill that sort of high deductible.
I lied. I'll ask you one last question, which is, a year from now, how do you expect we're going to see the healthcare landscape?
I think you're going to see the challenges we see today in the systems be cleared up. I think you'll see more and more of the exchanges. I think the exchanges will have more comfort both for the employer and for the individual. So I think there'll be probably a lot of the noise that we see today out, and I think people will be able to make clear decisions. I do see that there will be continued growth in that area, and I see continued growth in the Medicaid program and helping states along that area. And I see those two areas as significant growth in healthcare. But I see this constant change going from sick care to health. I think it is a wave in the country that I think for the next decade is going to make a great impact, combined with the technology innovation that we see, not so much on the medical side, but on the consumer engagement side. And I think we have some really exciting things in the future.
On that optimistic note, thanks, Bruce Broussard, President and CEO of Humana. Thanks for joining us.
Thank
Always
you.
great to talk to you.
Thanks.